April is National Cancer Prevention and Early Detection Month, and I promised you a daily fact this month about these topics. So day 2, we're going to talk about the 4 cancers that the CDC recommends screening for. And this is what's recommended by the United States Preventive Services Task Force. So the 4 cancers that routine recommended screening for are breast, cervical, colorectal, and lung cancer. There are other cancers that we can screen for, melanoma, we can do skin checks, prostate cancer with PSA levels. There's some nuances to those and we can talk about it, but the 4, again, are breast, cervical, colorectal, and lung. Now, there's a lot to say about screening for each of these cancers. There are some discrepancies and variability in terms of how often to screen, which age to start, with which modalities, and a lot of that depends because different professional organizations and societies all have their own recommendations. But I'm going to give you some very basic facts. When we talk about screening, we talk about people who have no symptoms to suggest that cancer. If you, let's say, have a breast mass, that's not screening, that is a diagnostic workup. So screening is for asymptomatic individuals. And some of the information that I'm going to give you here is for people who are of average risk. So if you have been determined to be at high risk of a cancer due to genetics, family history, or other factors, you don't really fall into this average risk screening category. So breast cancer, average risk screening starts at age 40 with a mammogram every year, and then considering ultrasound or MRI if you're of higher risk, or if you have dense breasts. Again, that's kind of in that outside category. Colorectal cancer, we start screening for average risk individuals at age 45. Gold standard is a colonoscopy. Some people end up getting, let's say, a Cologuard test, but colonoscopy starting at age 45 is the gold standard. Lung cancer, we start screening at age 50 for people who have a 20-pack year smoking history and who currently smoke or who have quit within the past 15 years. And we screen with a low-dose CT scan every year. And cervical cancer, the guidelines vary here a little bit, again, depending on organization, but we start screening at age 21 with pap smear testing. Obviously, it's a little bit more nuanced than what I can tell you in 2 minutes, but as you're listening to this, I want you to ask yourself, have you had and are you eligible for screening for these 4 cancers? And if you haven't, this is the time to make an appointment. I will go into screening for each of the cancers in a little bit more detail this month because there's nuances again in how often to do it and when to stop and all of that. Let me know your questions.